What's up, Outliers? Welcome to another video. Today we're going to go over the 5 most common injuries in action sports, which ironically are just 5 very, very common injuries, period. But these ones actually have a lot to do more so with like impact injuries and some common injuries like wear and tear. But all these injuries are pretty common when it comes to a sport that has high impact. So some stick and ball sports, fairly high impact or involve a lot of cutting, which, we'll get into. But ultimately, if you're participating in action sports, it's very likely that you have had one of these injuries. And if you haven't, I hope that you don't, because they're not fun. And they just kind of suck. So anytime you have to go through an injury, obviously you have to take time away from the activity that you're enjoying, and also it's just a pain in the ass as a whole. So the first most common injury I would say is ACL. ACL, especially for certain action sports like skiing, are very, very common just because of that bilateral stance, but each leg is still independent, so very common in that. But it also happens a ton in motocross. We saw it happen to Jet Lawrence just a couple months ago in Supercross, where he just put his leg down to catch himself, and boom, there goes the ACL. So what is the ACL, and what is the structures around the knee that might be the big cause of an ACL injury, or how can we prevent it? So first things first is the ACL is the anterior cruciate ligament. And there is also a PCL, which is the posterior cruciate ligament, LCL lateral, MCL medial. So basically we're creating a system around the knee of connection. And it's also important to note that ligament is a bone-to-bone connection, while tendon is muscle-to-bone. So we don't want to get those confused. So we're talking about a ligament, so bone-to-bone connection, and the ACL and the PCL sit inside of the knee. So unlike the LCL and the MCL that actually are more superficial on the outside and inside of the knee, when I say inside, medial side of the knee, the ACL and PCL actually sit more centered, and they actually cross each other, which is for structural purposes. And they attach from the tibia to the femur, so our 2 big long bones in the leg, helping keep them basically playing nice with each other. And when the ACL does get torn, it's typically because the shin bone will actually move anterior in front of the femur, and that causes the tear to happen. This happens mostly because of momentum-based incidents. So if you're we'll use moto for example, because that's what I do a lot. But with moto, it's when people stamp their leg to try and save themselves from falling down. What happens is the pressure causes the lower bone of the tibia to shift forward, while the femur slightly shifts backwards. And that is what causes that shear effect and tears the ACL. Now, another structure in the knee that's important to note, because usually when the ACL gets damaged, the structure is also damaged, and that's the meniscus, which is essentially a pad system between the 2 bones, because we do have cartilage in there, but we do need some padding because obviously we put a lot of impact into the knees. So the meniscus, meniscuses, those 2 things, we have an anterior, we have a medial and a lateral, so an inside outside on the knee, and there's the little donuts essentially. So very common for people to even just injure those, but the time of recovery can be very small to actually longer. Example, with the meniscus tear, they can go in there and just clean it up and take off usually what is just like a little hook, clean that up, a month, you're back at it. But it can also be a pretty good tear where, like my meniscus, when I had my meniscus surgery, that part of my knee actually came away from the tib, and it had to be cleaned up and pinned and all this crap. That was a full reconstruction, which took longer to heal from. That was about 3 months. But with the ACL, if you blow the ACL, it's likely that you're looking at a 3 to 6 month recovery. Sometimes you'll get a cadaver ACL, or you will get they'll take part of your hamstring tendon, remember tendon, muscle to bone, and actually use that to create your ligament and use that for the surgery and reconstruction for the ACL. Now, how can we prevent it? There's going to be certain instances where I'm going to be honest, you're not going to be able to prevent it. When we crash hard, no matter what, there's sometimes just nothing we can do in those instances to prevent injury from happening. However, you can strengthen the structures around the knee to help reduce the chance. I wouldn't say prevent, but reduce the chance of potential injury. So a big common thing that can happen is hamstring to quadriceps can become imbalanced in their muscular ratio and strength. So the quads become very dominant and the hamstrings can't keep up with it. Now, the quads help to extend the knee, the hamstrings help to flex the knee. And since that relationship gets jacked up, we have already an imbalance of strength structurally at the knee joint. So one thing that we can do to prevent that is try to keep our ratio of strength fairly equivalent to each other in ratio. So when I say in ratio, it's usually about a 2/3 strength for the hamstring to the quad. So if you're to like sit on a quadricep extension machine and you do 90 pounds, you should be capable of doing 60 pounds of a curl with the hamstring. I do like to see that ratio be a little bit closer just because strong hamstrings are very good for athletic performance, but also a lot of people tend to find that their knees just feel better in general when they have a strong quad hamstring ratio going on. So strengthening them both up is going to be helpful, but also strengthening up the glute muscles because the glutes actually control a lot of what the knee does. Funny enough, we don't really think of it that way, but a lot of people are familiar with the IT band, which is the iliotibial band. That is actually a big old tendon that comes off of our TFL, which tensor fascia lata muscle, and then our glute medius. A lot of Latin words is being said. Just know that your glute plays part in the structure of your knee and keeping it sturdy and keeping it in place, especially when we're under high forces and stuff like that, because the glutes are very strong. So strengthen up those areas. That can help a lot with, as I said, reducing the chance of injury, but I wouldn't say fully preventing because there's just going to be certain things that happen. And, there's things like braces and things like that. Still no promises that is going to prevent anything, but you can strengthen up your body, increase your ability to absorb impact through jumping drills, through agility drills and stuff like that. And overall, when we do strength training as a whole, especially through large compound movements, we're not just strengthening the muscle, we're strengthening tendons, ligaments, and bone. So that's going to be a theme that we come back to in this. I want to take a minute and talk about Next Hydration. So Next Hydration is an electrolyte powder, which actually I formulated. So pretty fun thing that I got to do working with one of my athletes to create Next Hydration. It has 800 milligrams of sodium, 300 milligrams of potassium, which is a wonderful ratio trying to mimic what we lose in sweat. And one of the big things I tried to do with this as well when I was formulating it was I wanted to make the flavor palatable, but also very light. And that's exactly what we did. So this is a very light flavor, more like lemon water rather than a candy beverage that you're also sucking down. So it's going to give you everything you need as far as the quality of the minerals and the electrolytes, but it's not going to leave you with the nappy, gross mouth. So if you want to try Next Hydration, go to nexthydration.com. Use code OutlierAthlete for 10% off your order. So next is the rotator cuff, the shoulders, right? So having gone through a shoulder surgery myself, my rotator cuff was safe, but I blew out my labrum rather than the rotator cuff. So the labrum is kind of more of a cartilage structure to the glenoid ball and socket of the shoulder, which isn't as quite of a ball and socket joint as, say, the hip, but there is a ball and there is a socket. But bear with me here. So when we talk about the rotator cuff, we're actually talking about four muscles. We're talking about supraspinatus, infraspinatus, teres minor, not teres major, but teres minor, and subscapularis. Those are the four rotator cuff muscles. So the best way to identify them, if we're looking at the body, is we have our shoulder blade. And on the shoulder blade, there's a bony process. We can call that the spine of the scapula. Above it, if we look above, is going to be the supraspinatus. If we poke below it, infraspinatus. Then if we come onto the side of our body just below the armpit, there is the teres major, which is the bigger one, and the teres minor, and we're talking about the minor. And then the subscapularis muscle is underneath the subscap. Okay, so underneath the shoulder blade and playing connection with the rib cage as well. So those four muscles make up that rotator cuff, which essentially is going to help us rotate our shoulder internal and external. So the internal rotator is the subscap, the external rotator is teres minor and infraspinatus, while the supraspinatus actually helps to elevate that shoulder. So if we raise our arm up, we got deltoid, and then past a certain point where we start to see that elevation actually at the AC joint, that's when we start to involve the supraspinatus. So in action sports, we take hits and we take falls, and there's times where we're going to outreach our arm, maybe we slide on it. That's one way that we can cause shoulder dislocation, because that ball will actually pop down into our armpit area. Kind of gross. But when it does that, the muscles of the rotator cuff become injured. And so this is very different from like the ACL, where we're talking about a ligament. The rotator cuff is a group of muscles. So we're tearing muscle, or we're tearing tendon rather than tearing ligament. Doesn't mean that there aren't little ligaments that exist around there, but the rotator cuff itself is a 4-muscle complex, just like the quadricep is a 4-muscle complex. Now, when we do have that happen and the ball does pop out, that's where we get labrum injuries. And there's 2 types of labrum tear, a Bankart and a slap. And that just depends upon the degree of which it tears at. So we're sliding, that ball pops down, and now we have a displacement of our humerus from our AC joint, which is the clavicle and acromion process. So that creates obviously a lot of damage to an area. Another way that this can happen is if somebody falls again, but now you're actually falling down onto your elbow, and that's jamming that humerus upwards. That can cause injury to your AC joint, which that would be talking about the ligaments of the AC joint. But at the same time, if we get dislocation, we can also have injury to the rotator cuff muscles. It's pretty common. I mean, we take hits into the shoulder. So there's kind of a couple options when we're falling and we're going to go down to the ground. No matter what the action sport is, you can either outreach your hand to catch yourself, elbow, shoulder. All these things are going to, cause potential injury, because then we talk about taking shoulder, and I'll honorably mention a broken clavicle or collarbone is definitely a part of, injuries that happen in action sports. But with that being said, it just kind of depends on how an individual falls. If you can tuck and roll, tuck that shoulder underneath, less likely to cause injury to the shoulder. I've been very lucky that for some reason I know how to fall well, but that's usually how I fall, is I'll take hits and roll around, which I've also had different types of injuries because of that, like intramuscular contusions to the rotator cuff muscles rather than tearing them. So intramuscular contusion is like a bruise inside the muscle, which I lost function, but I was able to heal it fairly quickly compared to if I was to need surgery on the rotator cuff. So, this is very much a preventable type thing, because you can practice falling for one, which sounds silly, but I'm not kidding. It does help. But 2, also strengthening up the rotator cuff muscles through external, internal rotation drills, and also just doing big compound movements with the upper body, so presses and rows and stuff like that to strengthen all the musculature around the shoulder, because muscle essentially is padding if you really look at it in that way, rather than just being like, oh, like I'm putting on muscle because I want to be stronger. If you look at it as I'm trying to create a capsule around a structure to protect it, that's a really good way of looking at muscle and gaining muscle, is because we're actually protecting that from impact, because we have now something to actually absorb forces, but also just it's stronger in general, right? Because like I said, with strength training, you're not just training the muscles to be stronger, but the bones, the ligaments, and the tendons. So it all comes back around, right? I said that was going to happen. So this is kind of a way to help reduce / prevent rotator cuff injury, learn how to fall, but also strengthen the shoulders and get them much stronger so that you're able to reduce that chance of injury to the rotator cuff, to the labrum, to the AC joint, and everything that goes on up there. Now, kind of keeping on theme with the falling, wrist fractures. So falling out with the hand extended to catch, breaking the wrist. So we have the radius and the ulna, the two bones of our forearm, and then we have a bunch of cuboids in our hand, and then a bunch of little carpals and stuff like that. So breaking a hand or a wrist is definitely common in action sports because when we outreach, to catch the impact, we can jam it. That's going to cause, usually if we jam and it's outreach, sometimes we end up breaking the cuboids in the hand, but we could also dislocate. But if it's a hard enough hit, then we're also breaking those long bones as well. But the big thing with these is these are broken bones, and there's levels to broken bones, of course, because we could have something of a fracture where it's literally just a crack. If we get a crack in our radius or our ulna, the long bones of our forearm, our recovery time is pretty low, even like 5-6 weeks for that to heal. Not very long. That's pretty easy. We will have some muscular atrophy during that time, but as far as like getting back to it, not very long. If you have a fracture in the cuboids in the hand, that's a different story because the amount of blood flow to those little bones is much less than the blood flow to like big bones and stuff like that. So sometimes you can get lucky and those bones will heal on their own, but if they get displaced, then you're looking at a potential surgery to get them basically pinned back together. The big thing with breaking the wrist or the forearm is some people will lose function or dexterity in the hand because of all the musculature that goes up. So as far as falling goes, I would say that's like my least favorite way to see people fall, especially if it's in, a hard packed situation, call it a concrete, you're on a BMX bike or a skateboarding and go to outreach your hand, just because they're not super strong compared to, the shoulder. Like I said, we can kind of learn to take impact there and roll, but that also does increase our chance of hitting our head. So all things said, there's no great way to eat shit, but if we can do it a little bit better, we can avoid certain injuries and stuff like that. But with the wrist, the forearms, and everything like that, big compound movements, again, are going to be one of the better things. Push-ups, pull-ups, anything that involves external weight is going to help strengthen up the musculature of the forearm, but also the bone, the ligament, and the tendon, as we keep on kind of alluding back to. Now, a common injury that happens, not just in action sports, I would say just period, but it's definitely something that needs to be addressed, is lower back injuries, because this plays a part in, a lot of people's daily troubles is lower back pain, lower back stiffness, and stuff like that. So when we look at the lower back, the musculature is a pretty different than the rest of the body because it's a lot of postural muscle. So a lot of muscle that's intended to hold us up, which makes a lot of sense. So that musculature runs up the back. We have some that run kind of outwards, but for the most part, we have very up and down musculature. And that's going to help keep our posture, as I said. But what tends to happen is in the lower back, we have the 5 lumbar spine, and then we have 12 thoracic spine, and then 7 cervical spine. The lumbar spine is made for up and down impact. They're very big vertebrae and they're capable of a lot of force. But when we get force with shear, that's where we get injury to disc, like herniation or bulging disc and stuff like that. And usually when those injuries happen, that's when musculature seizes up, especially like the quadratus lumborum muscle, the QL muscle, will get super tight. And even after injury has subsided and actually healed, the musculature will remain tight and continue to give issues. So one thing that we can do for this is strengthening the hips, but also mobilizing the hips will give a lot of relief to the lower back, because The hips are a very mobile set of joints. So if we can improve the mobility down there, we can allow the lumbar to be a structural joint complex as it's intended. And then same thing with the upper back, with the thoracic spine. If we give it more mobility, we can take some strain away from that lower back. And of course, strengthening up the core. And when I say core, that's full 360. We're not just talking about the abs on the front. So doing core exercises that are actually going to increase strength all around is going to be super helpful. Things like dead bugs are super awesome. Farmer's carries, bear planks, and stuff like that are some of my favorite go-tos for core strength. But also, if you're one of those people that are comfortable with weightlifting, if you're familiar with the Valsalmer maneuver, which is bracing the core, where we actually take a breath and close our glottis and increase our intra-abdominal pressure, we can actually develop a lot stronger 360 core, and that's going to help a lot with reducing back pain as a total, but also reducing chance of injury in the lower back. Now, lastly is concussions. Now, I saved this one for last because it's very loaded in the way of like what to do and how it affects people, because a concussion has so many different levels to it depending upon the magnitude of the hit. Because you could be totally fine and not even be knocked out and still have a concussion, or you could be knocked out for a minute and need to go to the hospital and be scanned and all this stuff. So there's a lot of different levels to it, but it's very common in action sports for concussions to occur. So the best thing that we can do to help prevent concussions is, for one, wear proper helmet safety. I don't care what the sport is. Helmets are very important, and it's so funny because growing up we're told they're not cool. We got made fun of, and now I swear that our generation wears helmets more than anyone else because we know better now, because we all hit our heads without helmets. So good proper protection is definitely going to be number one. But what's really happening when we hit our head and get a concussion is the force of the hit. So we slam our head down. So say my head's going this direction, but my skull stops because it hits the ground, but the brain actually continues inside of the skull with the momentum, and that causes it to smack and kind of jiggle around a little bit, which is not what the brain wants to do. And this can happen in all directions, of course. So that causes trauma to the brain. It can cause bruising, and in bad cases, bleeding. So we don't want any of that with our brain. It's a obviously very important part of our bodies. So when that happens, it's, really rough on us. One thing that we can do to actually help prevent it slightly, though, and I say slightly because it's not a guarantee. If I don't care, you could be wearing the best equipment ever and hit your head just right still, and have a really bad concussion. So with that being said, though, neck mobility is super important. So I kind of talked about that with the lower back. Now I'm talking about it with the upper part of the back, which is the cervical spine, which is a part of our neck. So the cervical spine is the 7 vertebrae, basically like that nodule that you can reach back and feel that back there is kind of where it ends. So going up from there, and then we have our skull that sits on top of our C1, which is called our atlas. And what we can do is actually by reducing the amount of tension in our neck, which I'm definitely not like the perfect example for that because I have plenty of tension in my neck, but we have all this musculature around the neck. And if we can improve its flexibility and improve the mobility as a whole in the neck, we're going to be able to take hits a little bit better because we're going to be a little less rigid. So think of it as like smacking a really stiff stick up against like a pole. It's going to kind of reverberate back into your hands. You're going to feel that a lot worse than if it was like a wet noodle type stick where it smacks and it kind of slows all that vibration and impact down a little bit. So it's kind of a way that we can look at the neck. And though not perfect, it is something that you can at least do to help it. Of course, also strengthening everything around here, which is a unique thing to do. But if you gain strength, it definitely helps. Even gaining strength in some of your like jaw muscles and stuff like that can help. Now, I'm not going to tell you specifically how to do that because it's very individualized. But with that being said, there is something of a protocol that you can do if you do smack your head that is super helpful that I use with a lot of my athletes, and that's using creatine. So I take creatine every day, 5 grams. So if I was to smack my head, I would probably only increase my creatine uptake maybe to 10 grams for about a week, because the amount of creatine that's circulating in my brain is already increased. But if you're an individual that doesn't take creatine at all, then sometimes increasing for a week or two up 15 to 20 grams per day can be something that actually helps a lot with the recovery of a concussion. Now, it's not going to completely be this magic pill, because nothing's going to be that. Time is going to be the best thing, and always being patient and checking in with yourself. But when we do have those instances in action sports of hitting our head, rest, hydration, nutrition, and kind of being intuitive a little bit of what you need, and then adding in that creatine supplement can definitely be helpful. There are other things out there, but this is something that is kind of a go-to for concussions. So those are the 5 most common injuries in action sports. Obviously, I threw in a 6th one with the clavicle break, but that's honorable mention. It does happen a lot, but usually it's not too bad. So I didn't want to go into too much detail with that. But, I've had a lot of athletes break their collarbones and they're back in a couple weeks after getting it played in and stuff. So still not fun. We don't want to have to go through that, especially like having to go under anesthesia. But I would say ACL, rotator cuff, wrist, lower back concussion. Those are kind of the big 5 that are seen a lot in action sports. And like I said, across a lot of sports, especially when there's impact involved in them. So yeah, pretty tough. There's some things that you can obviously do to help minimize the chance of these things happening, but nothing's going to be perfect, because injuries happen sometimes just because the impact is too much or whatever the case be. But best thing I can say is prep yourself. Strength training is obviously going to be a great thing that you can do to help that, but it's not going to be a total, safety net for you to kind of lean up against. But with that being said, thanks so much for listening and sticking around to the end, and I'll catch you in the next one.